Hi, everyone. I'm Betsy Crouch with the At the Bench segment of the Incubator podcast. I'm here at the Synchrony 2025 conference from the Brain Foundation. And with me is the founder of the Brain Foundation, Dr. Pramila Srinivasan. Thank you so much for joining me. Could you please tell our listeners about the Brain Foundation?
The Brain Foundation's primary goal is to get the standard of care for individuals with autism spectrum disorders. So right now there is no standard of care, and the patients and the parents, caregivers, everybody is struggling to get access to medical care. And for those that really need it the most, who cannot articulate for themselves, this is a serious need that needs to be remedied in the near future. And so we started at the very foundation, funding basic science research, and then getting physicians to come and talk about their experiences with various drugs and protocols on this population. And now we are actually looking at multi-center clinical trials. So at this conference, we have podium presentations by basic science researchers. We have round tables and discussions on protocols. And this time around, we actually had a discussion on multi-center trial design for individuals that are affected by inflammation and forms of therapies that are commonly used in autoimmune and other inflammatory disorders, and the benefits that they've seen in this population with those protocols. So we are exploring that area further to see if we can do a trial for this group.
There are many things that this foundation does well, but I think particularly this meeting, what's been really striking for me as a person who runs a basic science lab has been the integration of the families and the patients, because it provides this level of accountability and this urgency to the work that we do that I've found, really inspiring and also, a wake up call, right? We have to do this better. We have to be integrating constantly with our patients. I mean, I've done some of this work with,
Mhm.
um, families who have had patients in the NICU, who have had babies in the NICU, and I found that equally inspiring, but also revealing. So I was just curious, what was one of the most surprising results or takeaways from the meeting for you?
From the beginning, we've tried to focus on bringing people together, and that's the reason we have the name Synchrony.
Mhm.
And part of the motivation behind this is that there is a lot of overlap. Like there are parents who are also researchers, there are
Yeah,
physicians who are also parents,
yeah.
and they get to see things in a lens that would not be possible if we kept these groups separate. And having this in a beautiful place like Asilomar Conference Grounds, which is full of nature and the beach behind me, this brings everybody together, and the families are able to participate. They're able to come in with their family, and the kids and the individuals with autism come in. They give their perspective. So the level of synergy is something quite remarkable. So every time I'm surprised by how much I people like this synergy. And I hear from researchers coming up to me and saying, when we're sitting and working in the lab, we don't know who this is going to benefit. But now I will keep this in my memory, and it motivates me to keep working on what I'm doing, because, someday this might be a therapy for somebody with ASD. And that's a remarkable thing. And this time around, I found that we had eminent institutions like Stanford and UCS have come to the conference, and they've
Thank you.
come all the way. They've come all the way from their institution to be here among the families, and also talk about the trial design. So, which is to me the gold standard of how we need to develop evidence-based care. So, right now, what is going on is that parents have no access to really high quality treatment backed by evidence. And so the parents who are advocates are going all over the country looking for physicians and therapies and treatments and trying to do it on their own, which is not scalable, it's not equitable, it's not ideal. And we need to really change that. And I'm hoping that with this effort and funding all the science, so every year we fund over $1 million in research. We are not NIH, but we do what we can to pick the best research.
That's excellent. Yeah, thank
Yeah.
you.
So we try to fund 10 studies out of the roughly 120 studies that come to our grant proposal request, right? So we do a very thorough job vetting these studies. And then we pick 10 projects to fund every year. And we have a mix of basic science, translational research, and even research related to speech, video, tools for individuals with high functioning autism. We cover the whole spectrum. And then we fund this, and then we keep in touch with those researchers. And then we again have them come the next year and give us their updates. So we really make sure that the money is going to making progress. And also, we make sure that every year they come in, they be part of the conference so they know who they're working for, which is the population. And then they also explain their, and they come on a podium presented to other academic scientists. So that part is really impressive because we bring the best researchers from all over the world now. It used to be all over the country. Now we have people coming. This time we had from South Korea,
From Canada,
Denmark,
Europe. Yeah.
Italy.
Yeah.
We had Italians. We had them from Denmark. So this is truly becoming an international movement now.
Yeah, I mean, I think this is really the next frontier, which is research that is done in collaboration, right? I think across different perspectives. So thank you so much for having me. I think to ground us, autism spectrum disorders are an emerging neurodevelopmental condition in our preterm babies. So it's something that we really need to be paying more attention to, even though we can't see it yet. Although that's emerging also in our patients who are here in the NICU. So, thank you so much for joining us again.
Thank you so much for
Thank you for having me.
talking.
Yeah, as you can tell, I've just been really inspired. So I hope our audience also finds this interesting, and feel free to check out the Brain Foundation.
The Brain Foundation website is brainfoundation.org. Please go there and register yourself by giving us your email ID, and we'll be sending you a lot of information about what we are doing. And if you're interested at all in autism or autism research, please keep in touch with us. If you live in the Bay Area, we have a run coming up in September, and we have a gala at the end of the year in November. And we want to bring scientists to this gala. And then we have an amazing event planned for the evening for fundraising for research. So if you're interested in supporting research for AST, please come by. Thank you.
Thanks. Talk to you soon.